meeting to order with roll call. We'll start this way.
Rob Perkins.
Susan Ivashevic.
Sarah Namarato.
Anthony DeLuca.
Amy Wise.
Barbara Griffin.
Thank you. Community corrections reports. Well, first of all, before we start, I would certainly love to welcome our new warden, Connie Clark. We're really happy to have you. You always did a great job as deputy warden, very responsive, very forthcoming, very transparent, and always got back to us immediately. So I have no doubt that you will fill the old warden's shoes, but we really welcome you. Also, before we begin, I will announce that we had a second motion on the agenda, which was withdrawn because the jail completed the medical notification policy. So Mr. Perkins withdrew the motion. Do you want to say anything?
Briefly, Your Honor. So the purpose of the motion was to, get to the finish line with respect to the medical notification policy. We did get a copy of the policy yesterday. We'll review it and offer any additional feedback that the board members deem appropriate. I can tell you that this is obviously it took longer than we wanted. I think we can all agree upon that, but that was not due to any lack of effort from Warden Clark and her team. They did an incredible amount put an incredible amount of time and effort into that policy. It impacted a lot of stakeholders. I guarantee you there's no policy even close in Pennsylvania that's nearly as robust and humane and fair. So I appreciate all the hard work the Warden Clark put into the policy. We'll review it, and either by motion or just individual feedback, we can offer additional suggestions, but thank you for getting that in place.
Thank you. Okay, Community Corrections Reports Renewal Center.
Hi, good afternoon. John Ross from the Renewal Center. Renewal Center contracts with the Allegheny County Jail for 180 alternative housing beds and drug and alcohol inpatient beds. We currently serve 79 county work release males, 12 county males in our drug and alcohol treatment program, and there are currently 21 county work release females and 8 county females in our drug and alcohol treatment program. So total males is 91. Total county females for July is 29, and total contracted beds filled is 120. That currently leaves us 60 empty beds. However, I just wanted to say that that really doesn't cover July's census. We had some very huge peaks in July. We got up as high as 146 beds, which gave us 30 females, which is our capacity for county females, and we had 116 males, which only left us with 34 empty beds. It's a quite fluid census at times, but whenever I give the numbers, I'm just giving the last day of the month. So I wanted to kind of prefix that the jail's doing a really excellent job at processing the reentrants through and really working with us to get the folks out that need to be out. During the month, though, we had 65 reentrants exit from the program. 41 were successful, 24 unsuccessful, 10 were escapes, and 14 were program revocations. Some were revoked due to the court. Others were unsuccessfully discharged and returned for behavioral issues. There were 0 deaths, 0 non-fatal overdoses, 0 uses of force, 0 self-harm, and 0 suicide attempts. The number of times the emergency medical services were called to either building for the county reentrants was 9 since the last oversight meeting, and they were all called for various health-related reasons. Just wanted to put out there some of the events that our reentrants are going to be participating in August. Some of our special community projects include participating in the 13th annual annual Historic Hill 5K Run, Walk, and Ride in the Hill District. It's scheduled for Saturday, August 15th. We're expecting to have 20 re-entrants volunteer for that event. And lastly, I mentioned at the last meeting, we have Joey's Place that's opened. It's really taking hold. And the reason I bring that up at this particular meeting, as the census continues to grow, is, many of these individuals that we serve there are, first off, they're all Allegheny County residents. The majority of them have participated in some form of the criminal justice system within Allegheny County. So we have contracts with the Department of Human Services, and we're licensed through DDAP. But it just really gives a great opportunity for these individuals to continue the recovery process in a safe, sober environment and continue, their reentry into society. And I just wanted to comment on that. And once again, if anybody's downtown, wants to take a stroll down 3rd Avenue, we'd be happy to have you for a tour.
Questions? Bethany?
Yeah, hi, thank you for all the information, really appreciate it. I know a couple months ago, someone passed away at the facility, and we haven't received any sort of mortality review or briefing or any sort of follow-up on it, the investigation into that death. Can we get a timeline on when we should be expecting that?
There has been no official report out of the coroner's office yet. We do have preliminary reports. The jail has the same reports that we have from the Pittsburgh Police Department that were there that day, and also the initial report from the coroner's office. We did recently participate in a mortality review with the Allegheny County Jail staff. I believe it was about a week and a half ago. Overall, it was a good meeting, really a lot of back and forth with, discovery and really looking at what occurred there. Out of respect for the individual that passed away, I'd be happy to do a sidebar or an executive meeting. I can tell you what the coroner's report says and what the police report says. Once again, they are preliminary. But yes, the jail and us have been collaborating and, working together to really look at this particular incident.
Yeah, sure. I don't at all expect you to go into it in a public meeting. That's not what I meant. I meant more usually when things like this have happened in the jail, we schedule an executive session to go over the mortality review together. Are you saying that that's just not finalized yet, that you started preparations last week with the jail and that a final report isn't going to exist until the final coroner's report exists? Or what's the process? Is that more a jail admin question?
We're following the jail's lead.
Okay.
Yeah, I mean, we would be happy to review the information that we have so far, but we do not have the final report from the medical examiner's office at this stage.
Okay, cool. Yeah, maybe we can follow up after the meeting to schedule something. So thank you.
And we did just meet, I believe it was last Thursday, at the jail. So there was various members of the jail administration there, as well as, members of the renewal team there. And, we've fully disclosed and, cooperated, and really worked with the jail in this process.
Yeah, I guess I just didn't even realize that the jail played a role in the mortality reviews at renewal. So thank you very much. I will be following up with that. Thanks.
Ms. Perkins?
I have a couple of follow-up questions. Is the final report done, the mortality review report?
No, it's not complete yet.
Did they change the time? It used to be 30 days. Is that extended under a new
The time
policy?
has changed, yes.
Okay. To what?
90 days.
Okay.
And that, when we had our meeting, we were probably only 45 days out. The incident happened on June 13th.
Got it. One other question about Joey's Place. So how many people can reside in Joey's Place at one time?
28 males. We have 2 floors, so 14 males on each floor, and then there's another community floor. We do provide all their meals, and the facility is brand new.
How many people are there now?
I think about 18. And we have referrals continue to come in. We get referrals from actually people in the jail, other community providers, Gateway, White Deer Run, Pyramid, various other treatment programs. Once again, they all have to be Allegheny County residents because it is funded through, Allegheny County Department of Human Services. I envision probably within the next 30 days to have a waiting list.
Now, do you accept referrals outside of the jail and renewal itself?
Oh, yeah. Yeah, that's what I meant. Well,
Yeah.
Pyramid, Gateway, White Deer Run, other outpatient providers. And then when they're there, they can go to any, outpatient provider in the community that, they need to, whether it's drug and alcohol or mental health.
And what is the length of stay?
We're contracted and licensed for 5 months. But that includes everything. It really gives those individuals the opportunity to gain employment, go to school, training, apply for, other opportunities for housing, and so forth. So it's really a nice program. We're located right downtown, so transportation's not an issue. There's a lot of availability to services.
Okay, thank you.
Thank you.
Thank you.
Electronic monitoring.
Good afternoon, Board. Steve Eswine for the Probation Office. So for this reporting period, we had 577 individuals enrolled in the program. Of that, 50 of those successfully completed, and 4 were removed for various violations. So, any questions?
Questions? Thank you.
Thank you.
Okay, public comment on board actions and motions. We have one motion this evening regarding implementing a cap on forced overtime. John Kenstowitz.
The need to cap our CO's 16-hour shifts to 2 shifts. When science speaks to us, we need to listen. You have been provided 2 articles, one by Dan Jarvis, who co-designed the PTSD treatment for our residents, first responders, and our officers, where he identifies the unique stressors of our correctional officers. The other article is by Dr. Joanna Fong of UPMC. Her expertise being in sleep physiology and the loss of sleep, in which she identifies the dangerous consequences of a very prolonged work shift, such as our officers working these 16-hour shifts, 3, 4, or 5 days in a row. Dan states the shift may require vigilance against violence between individuals, threats against staff, manipulation and deception, medical emergencies, suicide attempts, verbal aggression, chronic exposure to trauma, and a high responsibility with limited control. Correction officers are expected to maintain professionalism, emotional control, and situational awareness while working in one of the most psychologically demanding environments in public safety. Dr. Fong states mandatory overtime in corrections produces sustained wakefulness at levels that federal regulators have determined to be unacceptable in every other comparative safety critical occupation. The sustained wakefulness produces degraded sustained attention, impaired executive function and judgment, slowed reaction time, and an inability of the affected individual to accurately perceive the extent of their own impairment. Both Dan and Dr. Fong recognize the critical importance of recovery time. And Dr. Fong makes the important point that the most effective policies are constructed around rest and not around hours. They both concur in the critical importance of an officer being given a recovery time with these 4 and 5 16-hour days. Capping the 16-hour shifts to 2 gives officers that recovery time. Both officers are talking about it, and an officer can still work that 4th or 5th day after being given the recovery time on the 3rd day. The union supports this proposal, and I believe will make this proposal succeed. Our proposal only includes forced overtime. The staff turnover rate of 40% of our first-year officers will be decreased with this proposal. Dr. Fong draws a comparison between government-mandated limited hours of work for truck drivers and airplane pilots, yet there is no mandate for correctional officers. Our officers carry a loaded firearm. Can I finish this sentence?
Go, finish your sentence.
Okay. This is my last sentence. Our officers carry a loaded firearm on hospital runs, and if our officers are at the 76th hour of an 80-hour day shift, How can we expect the officer to have the tolerance, concentration, and judgment to make that split-second decision to use a loaded firearm if needed? Thank you.
Thank you. Sarah Reich. I don't know. Okay.
Recently, I've heard a couple blatant untruths spewed about the officers at the ACJ, and I'm here to rebut those untruths. It was recently said that officers with more seniority abuse the FMLA, causing further overtime and staffing issues for the newer officers. I wish my husband were here so I could introduce him to you, but he's at home sleeping. He's one of your more senior officers at the ACJ. He works more than his fair share of overtime, on average 3 times per week. To look at him, he looks healthy, but looks can be deceiving. He's one of the officers who has FMLA. He goes to work on days when his body is telling him to stop. You shouldn't do this. When he is so physically exhausted to function, he still shows up. He's forced to push himself past the limits of any normal human being. Imagine having to wait months to see a specialist, only to have to cancel because you had to stay for your 2nd or 3rd unexpected overtime shift that week. Imagine not being able to get a possible life-saving prescription because you had to miss your appointment. I wish I had more time to fully dive into what it's really like for him to manage his health, but I only have 3 minutes. I've told this board what it's like being a married single parent. I've told you what it's like for our children to look up at every event they have and miss out on seeing their daddy because he's either working or sleeping. I've told you our family is serving his 10-year sentence right along with him, and by the way, that's the approximate amount of time he's serving while working a 25-year career at the ACJ, his overtime included. I wish he could be here so that you could try to look him in the eye and tell him he's the problem. Tell him that he's the reason you can't figure out a solution that has plagued this facility for years. Tell him his health suffers because you can't manage to figure out simple mathematics. Tell our children that their daddy's FMLA abuse is the reason he's never home. You can't and you won't because you know it's a lie. You know what the real problem is, you just don't have enough staff. It was also said that escape attempts aren't happening, and I'd very much like for any of you to look me in the face and tell me that on 12/23/25, I imagined a phone call telling me that my husband was okay. I wish you could look him in the face and tell him that an inmate didn't try to twice escape while out in a public setting. Tell him that he imagined that an inmate got their hand on the hood of his holster. Tell him he didn't have to struggle with the inmate to make sure that a public safety issue didn't occur. Because escape attempts aren't happening, right? I now triple dog dare you to look me in the face and tell me that if 1 second had been different, that I wouldn't have been planning a Christmas funeral instead of a Christmas breakfast.
Thank you.
You're very welcome.
Sarah Hampton.
I think she's speaking on the agenda. I know it's no longer on the agenda.
Okay, then we'll wait till after. Okay, thank you. All right, can I have a motion to accept the meeting minutes for July 2, 26?
I'll second.
Thank you. All in favor?
Aye.
Any opposed? Motion carries. Any updates from any of the committees?
No.
No. Okay, new business. Motion directing jail administration, I move to direct jail administration to investigate and provide a written report to this board by August 28 of 26 relating to the feasibility of implementing a cap on forced overtime for correction officers as follows. No correctional officer shall be compelled to work more than 2 consecutive 16-hour shifts. Further, any such officer shall be extended a mandatory 10-hour recovery period before their next shift. Second. Any discussion? All in favor? Aye. Any opposed? Motion carries. Warden's report.
Good afternoon, Board. I know a lot has changed since we last met. This is certainly not the first time I've addressed you as a member of the ACJ administration, but it is the first time I've done so in this new role. I'm honored to be entrusted with the responsibility of being interim warden, and I'd like to thank the county executive and the county manager for giving me this opportunity. I also want to thank Warden Wingard for his leadership and mentorship during his tenure. He brought vision, innovation, and transformation to the facility. He saw an opportunity to make the jail a better place for all to work and live, and I look forward to continuing that important and necessary work. He allowed us to dream and to believe in ourselves and our abilities to enact change. A lot was accomplished during his tenure. Those accomplishments are clearly the result of a great leader. If he were sitting in this chair tonight, he would tell you it was the work of an amazing team who brought his dreams to life. That team has been entrusted to me, and I look forward to leveraging their incredible talents to continue to make improvements. We've made great strides to increase transparency and improve communication and collaboration with the Jail Oversight Board, reform activists, family members of the incarcerated, staff, and residents. I am committed to maintaining transparency and communication throughout this transition process while continuing to develop those relationships. An important part of leadership is surrounding yourself with competent advisors and deferring to experts when the situation warrants it. I believe we have staff members in place who can assist and take the lead in their respective areas of expertise, and that's why the entire team is so valuable to me. Each perspective makes us better and helps to make process improvements. I began my career in corrections 26 years ago, working as a security monitor at Renewal. In that role, I conducted pat-downs, head counts, searches, and drug screens. After about 9 months, I was promoted to the intake department, where I first stepped foot into the Allegheny County Jail. During my time at Renewal, I spent a lot of time inside the jail, where my first teachers were correctional officers who taught me the inner workings of the jail, the legal system, court records, and so much more. I have collected and carried the wisdom of many with me throughout my entire career. My work at Renewal defined my career path because I had the opportunity to see how people could change when they are provided with the proper tools. While at Renewal, I worked with individuals coming out of federal and state incarceration, as well as the Allegheny County Jail. For reasons still unclear to me, my passion was always working with the county jail population. Perhaps it was the instability I saw or the rawness of their pain, but I knew if presented the right opportunity, I would one day work at the jail. In December of 2013, I got that opportunity when I was hired as the Administrator of Alternative Housing and Diversion. From that role, I was promoted to Administrator of Reintegration, Assistant Deputy Warden, and Deputy Warden. Each promotion has faced new challenges, but none compared to the challenges that I now face as interim warden. I've spent my entire career focused on providing opportunities to the incarcerated population so that they could better themselves. And while I intend to continue robust efforts to help the incarcerated population, I will look forward to channeling that passion and using those skills to also improve the well-being of the staff at the facility. Working in corrections is not a job, it is not a career, it is a lifestyle. Long hours, stressful work days, seeing people at their worst, and giving all of yourself to try to make someone else's day a little better. The work can be mentally, emotionally, spiritually, and physically exhausting, but the work can also be incredibly rewarding. We often speak publicly about the negative things that happen in the jail, but we don't often recognize the people who go above and beyond to support each other. We often overlook the humanity that can be seen in the jail every day. I see it often. I see it in the officer helping someone who's having a difficult time walking. I've seen humanity on the juvenile housing unit where officers regularly play ping pong with the incarcerated population. I've seen officers learn Spanish so they can better communicate with someone who is Spanish speaking. I've seen the pride in a teacher when a student reaches an educational goal that they did not think they were capable of achieving. We have doctors and nurses who could work anywhere, but they choose to work in our jail because they are passionate about serving this population. I've seen many lives improved by our medical team, and I've seen many lives saved. Unfortunately, the good things that happen get overshadowed by the negativity, but I can assure you that good things are happening every single day. It's no secret that working in corrections is a difficult field. We see individuals on the worst days of their lives. This is inherently stressful work that can take a toll on staff. At the same time, we're a 24/7 facility that never closes, requiring long hours, difficult shifts, and dedication from employees. It takes immense teamwork, buy-in, and mutual reliance on one another to successfully run the facility. We all desire what is best for our jail, but that often means navigating competing interests, goals, and experiences. I'm confident we can find middle ground to maintain and continue the great progress that we've already made. I will be searching for ways to improve staff wellness. The CARES Association has opened the new Staff Fitness Center. They converted a closed housing unit to a place where staff can go to exercise. They plan to continue to make improvements to the space, and we are hopeful it is a place that everyone can enjoy. I also hope to offer learning opportunities that will educate staff on stress management, mindfulness, nutrition, conflict resolution, budgeting, parenting, and other wellness-related topics. I'm also exploring opportunities to implement supports like Healing for Heroes. I would like to establish a structured mentoring program to support new employees as well as those seeking career development. Ideally, the program would include job shadowing, goal-setting sessions, peer-to-peer mentoring, and the ability for newer employees to pair with experienced leaders. The program will be designed to steer career development, provide support to employees, and build stronger relationships with mentors who have proven success in their role. To ensure that the programming team continues to thrive, I am pleased to announce that Casey Walsh is stepping into the role of Acting Deputy Warden for Programs and Services. Ms. Walsh has demonstrated her valuable experience and knowledge as the Correctional Support Program Manager since joining the jail more than 2 years ago. In that role, she's overseen the caseworkers, supervised contact visits, implemented language access procedures, connected with community resources, and worked hand in hand with programming staff. She was a familiar face when she began working at the jail after spending 7 years working for the Office of the Public Defender. I have full confidence that she will carry on the vision that we have set out for jail programming, and I look forward to seeing what innovations she creates for the residents. I want to update the board and the public on the water testing at the facility. During routine preventative testing of our water system in July, 2 officer bathrooms tested positive for compounds that could be Legionella. We immediately contacted the health department and followed their guidance. We were advised by experts at the health department to conduct further testing to confirm whether there is Legionella in these fixtures or not. To date, we still are awaiting results from those tests. We've taken intermediary steps while we await those results, including closing off access to the fixtures where the test results indicated the potential for Legionella. We've engaged with a vendor who is an expert on testing and remediation. They will guide future testing as well as any future remediation efforts. And we are establishing a water management program that will ensure long-term oversight and testing to ensure the health and safety of staff and residents. It is important to note that we do not have any confirmed cases of Legionella-related illnesses. We are determined to act quickly and to ensure that we are doing everything in our power to maintain high water quality standards in the facility. And we are being guided by health department experts, facilities, and outside vendors to ensure we're taking the right steps. Last week, the City of Pittsburgh proudly hosted the American Corrections Association Conference. As the host city, the jail team was called upon in many ways to support that conference. We volunteered, had a host city display booth complete with artwork done by the incarcerated population. We hosted 2 tours of the jail, a general tour and 1 medical. The Honor Guard presented the colors during opening ceremonies, and our professional team was able to educate others through 5 presentations that Allegheny County led at that conference. Those presentations provided education to national leaders about our reentry program, substance use treatment, mental health care, mobile competency restoration, and the Matters Network. Since the conference was local, we were able to send several staff who all enjoyed the opportunity to learn from and educate correctional leaders throughout the country. As stated previously, we have finalized the notification policy to ensure loved ones are notified when an individual requires hospitalization due to a serious illness or injury. That policy has been signed and will be in effect on next Thursday, August 13th. Over the next week, we will be training staff to ensure proper implementation of the policy. We appreciate the collaboration and feedback that the board provided on the policy. We know this policy did not come as quickly as anyone had hoped, but good systemic change takes comprehensive analysis, planning, partnerships, and education. I continue to be inspired by the people who work and live at the jail, the passion and dedication shown by the staff, and the resiliency of the incarcerated population encourages me to keep showing up and keep doing the work. Working together with all stakeholders, including residents, staff, the Jail Oversight Board, family members, and more, we can continue to innovate and model exemplary standards and remain a national leader in corrections. Lastly, I want to thank everyone who has sent me well wishes, offered me support, thoughts, and prayers. I too am human and imperfect, which means mistakes will certainly be made, but we will learn from them, work hard to correct them, and make every decision in the best interest of the jail and those who work and live there at the forefront. That concludes my report. Deputy Martin will provide the health care.
Good evening, Board. For our SUD team, we had 499 patients treated in our MOUD and MAT program. 55 groups were held for SUD, and 177 patients participated in those groups. For mental health data, State Hospital, 8 patients were admitted and transferred to Torrance, 8 were admitted and transferred to Norristown, 19 were committed, 4 patients had their commitment rescinded, and 21 are on the wait list, longest waiting since January of 26. For our tier data, we had 0 on tier 5 and 22 on tier 4. Mobile Competency Restoration Team is currently serving 87 patients. 39 of those are in ACJ, 48 are in the community. They were able to rescind 4 commitments this past month. For a sick call as of 8/6, 19 in the medical queue, longest waiting 2 days. For the mental health queue, 16, longest waiting 2 days. For the dental queue, 11, longest waiting 2 days. For the psychiatrist queue, 690, longest waiting 46 days. For refusals at intake at the clearance section, there was 27 last month. Those were for various reasons that encompasses instability to stay as a new arrest. And for the level 5 specialty clinic visits, there's 1,319 visits completed. For information regarding HIV and STD testing availability, every person that is booked into the facility gets offered that in the intake area. And then when they get upstairs, they're also, that's when they draw the blood for HIV testing. STD testing is done in intake, HIV testing is done upstairs once they get on a pod. Anybody is also able to send a request to our public health team through their tablet systems to get testing if they need to. This past month, we also implemented the biometric wearables as a phased rollout. We began in the intake area, focusing on those coming in for those at risk for withdrawal management and anyone deemed medically vulnerable. Our first night using them, we actually received an alert which resulted in an evaluation and further intervention. We are continuing to adjust workflows and policy as this project will be expanding to the new court pod soon. And the openness from all the staff, both on the healthcare and the operations side, has been so welcoming to work with everybody during this time. That's it for my report. Deb?
Hi, everyone. Nice to see you all. Hi. So I'll start with the Foundation of Hope. Talim study sessions have expanded to weekly services. Juma and Talim services will be starting later this month. In July, 23 participants graduated from the Foundation of Hope program. Debbie Spivey and DeJuan Williams delivered inspiring messages at those graduation ceremonies. Population management. The average daily population of the jail in July was 1,698. This is a 9% decrease from July 2025, which had an average daily population of 1,866. Reentry services, the vocational training program, averaged 361 participants per week in July. There were 3,600 vocational training shifts, 1,986 educational programming classes, and 9 graduates from the HOPE program who received the incentive payment in July. The average amount paid to each participant was $62.11. Through our partnership with the Allegheny County Library Association, we obtained reading books and play areas for children to use in the visitation area of the jail. The project was funded by the Clinton Foundation. In partnership with the Health Department, on July 16th, we hosted an overdose prevention pop-up event. The event provided valuable resources to jail employees, residents, and families of those incarcerated in the jail. Thanks to the generous donation of Bidwell Street Presbyterian Women's Group, the Discharge and Release Center received a donation of notebooks, pens, bags for those being released from the jail. The TAILS program has resumed with the addition of Lola, and she is an 8-year-old mixed breed who is full of love. Educational services. On July 7th, a creative writing programming began in the school for the juvenile population. Through a partnership with Revisions Pittsburgh, volunteers are coming in to help students build critical writing skills, think creatively, learn to craft strong narratives, and to give students an additional outlet to express themselves freely. Thank you to Tanisha Long for coordinating this with us. Summer school ended on July 10th, and the regular school session resumes August 24th. That concludes my report, but today we have Jen Flanagan from Community Kitchen here to present some training opportunities that we have for our residents. Thank you.
Hello, everyone. Thanks for the opportunity to speak. We are Community Kitchen Pittsburgh. We are a workforce training organization. Excuse me. Now I'm choking on something. Excuse me. We work with individuals that are, oh, my voice has gone, so you're just going to have to listen to me like this. I will take it. I apologize. I don't know what happened. Thank you. Here you go. I appreciate it. So we work with adults overcoming barriers to employment. 2/3 of our participants are justice impacted. We operate 4 different food service business lines for the sole purpose of training and offering transitional employment opportunities to our participants. That's contract meals, catering, a food truck, and a butchery program. This year, we launched an in-facility program at ACJ. This is a 6-state initiative funded by the Department of Labor. It passes through the National Restaurant Association's Education Foundation, and we are a subrecipient and the Pennsylvania partner. This program is funded through December of 2028. So through this program, we are providing classes in the jail, serve safe handlers, and a job readiness course called Restaurant Ready. Both of these are industry recognized credentials. And so the job readiness curriculum covers attitude, communication, personal responsibility, industry specifics, learning techniques, and customer service. So the point of this program is to engage while folks are in the facility, and then we provide post-release engagement. We want these folks to come to us after they get released. So they have an opportunity to enroll in our training programs, which is embedded into all of our food service programs. They can join our transitional employment program if they need a supported work environment for a few months. They can just come in for assisted job search. We have a lot of contacts throughout the city and a really great job placement rate. Our job placement rate is 95% for folks who complete our programming. We provide resource navigation, so referrals or direct support for folks that engage with us. We can also do things like pay for them to get driver's education and a driver's license. We can help with first month security and security deposits for apartments. There's a lot of things that we can do for folks if they engage with us on release. Anyone who engages with us gets bus transportation, uniforms, anything they need for a job. And then we do 12 months of retention support. So we follow people for 12 months post-placement just to help them keep their job, help them navigate pay increases, promotions. So we started classes in February through May. That first section of classes, we had 108 men and women come down for the classes. 59 of them completed their Serve Safe classes and passed the test, and 78 completed all of their restaurant ready classes and got that certificate as well. I just want to thank the reentry team. They are a fantastic partner for this, and everyone's been really helpful and supportive as we launch this program in the jail. So thank you. Yeah.
I love this program. I think it is incredible. I just have a question about the actual certifications. There's the two different certifications. So is the reason that the number of people participating in the program is higher than the number of people receiving certifications because they leave the jail?
They leave the jail, they miss classes. Most of the time it's because they're being transferred out.
They're leaving, okay.
Yeah. And we do, if they are released, they can finish those classes with us in the community as well.
Coming down to the facility and doing it there
absolutely.
outside the jail.
Yep.
Okay, and then the other thing is it every single person who works in food preparation and food service who is included in the offering, or is it certain people?
Technically, it is for sentenced individuals, but we have served a lot of folks that are not yet sentenced, and we're trying to get creative on how when we enroll people so that they are eligible for the program.
Great.
Yeah.
Thank you very much.
Absolutely, thank you. And thank you for the drink.
Oh,
too. Thank you.
Yeah, one last question,
Please.
if you don't mind. I first have to say I'm a huge fan of Community Kitchen. I know a few folks who have gone through the program, and I know some folks that you partner with as well. I guess my question is, what are the odds or what are the chances of you combining this training program with, actually becoming a food provider for the jail itself?
We would love to do that. That's above my pay grade.
Just putting it out there. Just putting it out there. All right, got you.
Yeah, thank you. Anything else? No? Thank you
so much.
Yes, that concludes our report, Your Honor.
Thank you. Questions? Ms. Griffin?
Yep, I wanted to ask a couple of questions about the new policy for emergency notification. And does the jail keep track of who has made a designation? And are there numbers about whether it's most people or not that many residents or?
So yes, we keep track of who that person's emergency contact is electronically, but that data is not compiled to make the analysis that you're looking for. I wouldn't speculate, honestly, on what the numbers are, but there are quite a few people that do not have emergency contacts.
I'm thinking the policy kind of has, which is new, which is great, a new process for trying to get those emergency contacts, but it starts with intake, and so requests being done at intake, and then there's the ability to make that change on the tablet. But I'm wondering if there's something that could happen in between those things, because I can imagine when someone is in intake, that's the most stressful, and people are going through all kinds of things at that time.
Right.
I can envision situations where a person says, doesn't want to make a designation. Maybe they think, I'm not going to be here very long, so I'm not going to do that, or I don't want to make a designation because are you telling me something bad's going to happen to me? I'm not going to do that. And, as much as family members and loved ones, we talk about them wanting to know about that resident, it really is upon the resident to authorize the release of that information. They've never done that, then you can't tell family members. The same thing with the, so I'm wondering just if there's think about whether there's, we have lots of volunteer programs that we've heard about tonight at the jail, information sessions and such, whether there's a way to do some follow-up between intake and you can do it on your tablet to remind residents that if they want their loved ones to know what's going on with them, they need to let the jail know who that person is?
So we have posted notices on the tablets letting them know how to make those emergency contact notifications. With the implementation of this policy, we are sending out new advisements on that, what they can do for both the emergency contact as well as the release of information. So that information will go out next week as this policy is implemented.
Maybe consider whether there's a way to run a report on, where you are on that, so that if there's a huge gap, people who have them, people that don't, maybe there's more that can be done on that. Thanks.
Anybody else? Mr. Burke, Ms. Innamorato?
I have a question. There were a couple comments around HIV testing, which you touched on briefly, that they happen once people go up to the pods. In the comments, they mentioned weekly testing. Is that standard practice in any carceral facility?
I don't think that's standard practice. Sorry. That wouldn't be standard practice. That would be clinically indicated to do weekly testing.
Okay. And then do we run an HIV testing program that is an opt-in or opt-out? Meaning, do people select and voluntarily get tested, or do we just by default test everyone unless they opt out of it?
It would be more of an opt-out. We offer to every single person that comes in through intake. Some people do refuse to get tested, and that's their right to do so. But we do get a really good rate that do get tested.
Okay. Thank you for clarifying.
Mr. Perkins?
Yes. So I'll follow up with Barb's question about the medical notification policy. So I think it's one of the vast improvements from the prior policies. There was really no protocol for making sure that we did do our best to collect that emergency contact information. So can you address that, like what you've added to the policy that was not there before that gives us more accountability to make sure that we are getting, because I guess some historical perspective was a lot of people didn't have emergency contacts, so we didn't know who to notify whenever something terrible happened.
Right.
Now there is more of a protocol, and I think we can improve upon it, and Barb had some good suggestions, but like, what is in there now that wasn't in there before?
So this policy details exactly how people and at what points when they're in the jail that engagement happens for them to list who their emergency contact is, how they change emergency contacts, that does happen, and at what points of engagement releases of information can be signed and how they can get those releases signed if they change their mind or have a change of who they want to receive that information while they're in the jail. It also details and defines things that weren't defined in the prior policy regarding the definition of serious illness and injury, regarding hospitalization, and at what point and who makes the determination on how those notifications get made.
Okay. So just one suggestion, since we're offering suggestions. I mean, could there be a way to automate it that, like, if there's no emergency contact indicated in the records, there could be some type of alert system to say, like, we should follow up with that to make sure we get an emergency contact?
That's something we can explore with the team, yeah.
Okay. And as far as the definition of serious injury and serious illness, does that include admission to a hospital?
Correct.
Okay. So I have some questions with respect to the commitments to Norristown and Torrance State Hospital. So did you say that there were 8 people were sent to Norristown this month?
Yes.
So what changed? Because for a while there, we were sending 0 to Norristown. Do you know why that changed?
It just goes off of what they're accepting.
Okay.
We have no control over any of that.
Is there like a designated contact in the jail where we're like, hey, we called Norristown and they say we have no openings? Like, who's responsible for doing the outreach to make sure we make every effort to get people into a hospital so they can come back and face their charges?
So we work closely with court administration through the whole BAU process, the commitment process, to see who's going when and where.
All right, so you don't know like why we went from 0 to 8 then?
I don't.
Okay.
They just may have had some beds open up. It's both hospitals deal with the entire state of Pennsylvania, so it all goes on availability.
So I asked this question last month, and maybe it's the same person, but January 2026.
It is the same person.
That's 7 months. So why would a person wait 7 months to go to a hospital?
They're more on the civil side than the forensic side.
So that changes the parameters as to whether they can go to a hospital?
It's not whether they can go, it's their availability of when they can go, when they have a bed open.
So are they in on criminal charges? Or it's just a straight up civil commitment?
This would be a civil commitment.
Okay.
So no criminal charges?
I'm not saying she doesn't have, or this person doesn't have criminal charges. It's just they're going to the state hospital on the civil side.
Yeah, I'm not sure how that works, but we'll ask some follow-up questions. So with respect to so let me move this. I have one data request for whomever is responsible. Casey's newest, maybe we can ask Casey to get it for us. So, I feel like one of the things this board can do is help reducing the jail population. That helps everyone. And so I had some questions with respect to an issue that we've been talking about for at least 1 year, and that has to do with us holding people for other counties. So personally, for me, I'm one attorney, and there's hundreds of criminal defense attorneys, but my own personal experience, I've had several clients recently who, sat in jail for weeks, if not months, because Washington County didn't bother to send the sheriffs to come pick them up, and that doesn't seem fair for us to hold people in jail for another county because they didn't get around to coming. And at one point, there was discussion of, communicate to the other counties that after 48 hours or 72 hours, if you don't come, get them, then we'll release them, which would be my preferred choice. But, but that didn't happen, and there was discussion instead that we were going to start charging people. So I just want to ask for some data, and if you could report back to the board, or someone can report back to the board. I'm not really volunteering you, Casey, but the data that I'm looking for is, we were told that we were going to start charging people. So I would like to know how much money we've actually collected so far, if any, over the past year or whatever, as far as, people reimbursing us for us holding people beyond the 48-hour 72 mark.
I can answer that question
Okay.
for you now, Mr. Perkins. So currently, we have one individual in the jail we're waiting for Washington County to come pick up, that has been there for over 72 hours. The courtesy hold is generally a 72-hour hold. You make notification to that county, and then they come within that time. We have drafted, and I am finalizing, an agreement that will go to every county detailing what we will charge per person per day, as well as medical expenses, should people be left in the jail beyond that 72-hour mark. So we have not started to, charge other counties yet, but we do have a plan in place to do that.
Okay, could you provide the date of how many people this has impacted and how many days they've remained in the jail over the past 6 months, for example? Would that be laborious, or would that be?
Yeah,
okay.
it would, but we'll do it.
I think that would be helpful, because if it's five people in 2 days, that's one thing. But
Right.
I said it's happened to me multiple times in the past
So-
month.
Right, typically our population manager monitors and follows those cases. So he's watching, and at that day 3, he's making follow-up calls to those counties to get people moved. So if it's beyond the 72 hours, generally speaking, it's a few days beyond the 72 hours, but I think that there's definitely still opportunity for people to be moved faster.
Okay, and it's not the population reduction manager's fault by any means, because I think the world of him, and I work with him closely, but it's other counties who aren't, necessarily complying. And just as another example of how this has negatively impacted people in our jail, I had another client who was released to inpatient drug treatment, and all we had to do was lift a detainer in another county, or had them do something with a warrant. And the warrant was because they didn't attend a court hearing because they were in jail. It wasn't their fault that they couldn't go to this court hearing in another county. But the consequence of that was they couldn't go get treatment. They remained in the jail, and I don't know if a bed's still available for that particular person. So
Those cases are a little more difficult because the person is generally still facing charges here in Allegheny County. And when that happens, the release from Allegheny County will be to release someone to treatment. But if they have a hold from another county, we have to reach out to that county to see if they are in agreement to release to treatment on their case. Sometimes they are, sometimes they are not. So those cases work a little bit differently than the ones that, have resolved their cases here in Allegheny County and are ready to move on.
But if they're not in agreement, they still sit in ACJ.
Yes, Your Honor.
Well, I think I would request that you look into that also, because they should have to come and pick them up. Should be on their taxpayer dime. Why should?
Because they still have pending charges here in
Yeah, but the
Allegheny
judge
County.
released the person to treatment. The judge didn't say they have to be in jail.
So I'd appreciate that. I think it just kind of help us understand the scope of the problem and see if there's a board motion that we can pass to kind of help get that, through the process. So one last question on the logistics. So what we do is we send out contracts to other county, and then they sign them? Like, how does that work?
Right, so we would send out the contracts to those other counties, and they would sign that agreement.
So what if they don't sign it?
There will be language in the agreement that we will not hold people beyond those 72 hours if they choose not to sign.
Okay, all right, thank you. So I have questions again about the DTU, because I ask those every month. And, I think we all agree that, we need to move on this issue of people on the, we're referring to the disciplinary treatment unit. It's a pod where people with serious mental health issues go if they have a misconduct of any, whatever nature in the jail. And during the rec time, they are handcuffed to a table, and they're either in their cell or they're handcuffed to a table the entirety of the time they're on that pod. Do we have any sense of any movement or any progress on changing that?
Just still working through the facilities to get our other pod opened up.
The issue is the structure inside the cell, the wall, there's a gap between the outside wall and the inner side of the cell. So we have to put a piece of angle iron there, cover that so they can't pass anything through there. And then additional things have popped up with the issues going on with that. So as soon as we can get it finalized, we're going to move them.
I mean, we have numerous open pods. Why do you have to use that one if there's issues with the cells?
We're talking about a Delta. They already have the recreation cubicles up there. We're going to move them up there so they'll have an opportunity not just to be placed on the tables with the restraints, they'll also be allowed to go into the recreation cubicles for rec. So it'll be more interactive up there. It'll give us different options as well.
Are you done?
Yeah, all right. So with respect to the wearables, I know I think I'm really excited about the potential of this. We met with a medical professional from Gateway Rehab who talked about the value of these and saving lives, and I think there's tremendous potential in it, but of course we want to make sure we implement it the right way and have policies in place. So can you speak to what specifically is in some of these policies and what we're doing to protect our residents' confidential health information?
So this project's been going on for quite some time now. Probably the past 6 months mostly has been like the really behind the scenes work between the vendor and our IT department to make sure everything is set up, the connectivity is okay, the privacy aspect's okay. The vendor does do penetration testing frequently to make sure everything stays safe. For accessibility, there's different user levels. Our medical staff has a different user level than an officer can see, so that data stays private for the patient.
What if someone doesn't want to wear it? Do they have to?
They can sign a refusal after some education. We always want to educate somebody first on why we want to do something before we just, accept a refusal.
Okay. And how many people are wearing them now?
This morning, I think I seen 13.
13? Okay, so we're piloting and learning. And
We
then
are.
can
It's a phased
expand it.
rollout. With it, we focus on intake first, get everybody coming in through the door, and then we will be rolling it out to the other housing units for the intake, the new court housing units.
How's it been so far as implementation?
I think it's been really well. The officers have been giving us really good feedback. The healthcare staff has been giving us good feedback. With all the feedback we're getting and ideas and suggestions for like streamlining, it's all really reasonable ask. So we've just been kind of working through the policy. We met yesterday as administration to go over policy and workflows. And we have some upcoming meetings, with the subcommittee, with the vendor, and some other ideas coming up just to make sure it's rolling out okay.
Okay. And I would know myself and Dr. Dialer are coming to meet within a couple weeks to get a little bit more specifics and review the policy. So that's all the questions I have. Thank you.
I have a question on healing the heroes, and you might not know the answer to this today, but the old warden, of course I'm having a senior moment and can't even remember his name, Warden Trevor, I know the last name, Wingard, my God, was looking into training some COs to administer the Healing the Heroes program to other COs for peer-to-peer, peer support, best evidence practices. Do you know the status of that?
So we have an upcoming meeting scheduled with Healing for Heroes to get that information, and we would have to do a cost analysis, find out what it would cost for us to do it, and make some budgetary decisions.
Okay, thank you.
All right, just have a few questions. First, want to say hello to it's Casey Walsh, right? Okay, word. I'm a big fan of the program, and that's kind of like my jam, so I imagine I'll be asking you a few questions in the future. You gave a brief update on some of the religious services. You said Juma is going to be starting later this month. Is that correct? Okay, happy to hear that. But so far, there is a full-time imam now. Is that correct?
Part-time.
Part-time. Okay. How often does he come in? Do you know?
I don't have his schedule here with me.
Okay, I got you.
It will increase as we increase the services.
No, I hear you. But Friday prayers are happening now, right?
They will be starting.
Okay, they will be starting. Okay. I asked this question before only because it was brought to our attention. Folks who do practice that religion, they do have the ability to have or conduct their Friday prayers on their pod by themselves, even if they don't have an imam present. Is that correct?
Yes.
Okay, I got you. We used to get updates about the different religious services. Is that something that we could continue, even if it's not, in the public report? Or is that something that we could?
Sure.
Yeah.
No problem at all.
I think that would be helpful. Yeah. Appreciate that. Yep. My next questions are about the facilities.
Okay.
Oh, my fault. I thought she was whispering something. Of course, we want to know about the doors. Any update on the doors?
They're in, they're working.
They're in, they're working? Mm-hmm. Okay. So, meaning they're at the jail?
No, they're installed.
Oh, they're installed?
Yeah.
Oh, okay.
Employee
Perfect.
entrance, yeah, that's completed.
Oh, okay, it's complete.
Yep.
Really happy to hear that. Thank you. You talked about the work that's needed on 8D for the DTU pod. Is there a timeline on that?
I've tried that before. I can say that it is a priority.
Okay, I got you.
We tried caulking up in the cell to bridge that gap, and it was too easy to pick out of there. That's why we went to the angle iron and multiple different, trying to resolve that issue, and it has been an ongoing issue. Once that's completed, they are going to start working on painting and having a different paint theme up there, but it's very similar to ADECA.
All right, I got you. And correct me if I'm wrong, but there are some maintenance jobs that are done by incarcerated individuals, right? So, is that correct?
Painting.
Okay,
Yeah,
it's
painting.
only painting?
Yes.
Okay, got you. So everything else involving facilities like installation of the angle irons, even, plumbing, whatever, that'll be done by like facilities folks?
Yes.
Okay, I got you. What's the average wait time when you put in like a request for something?
It depends on the whichever discipline you're going to. Some are very fast, some are, based upon what supplies they have to order, what kind of logistics that go into that. So like the angle irons for each one of those, they have to punch holes into it, get the angle, anchors, all that. So that is taking a little bit of time.
Yeah, I got you. Those the bricklayers?
That's the, it's the steel workers.
Steel workers.
Yeah.
Oh, okay. All right, I got
The
you.
iron workers, I think are called.
Oh, okay. That's cool.
And we don't have those inside the facility. We have to request them from somewhere else.
Okay. Well, just keep us updated, please.
Will do.
We appreciate that.
Will do.
All right. My next question is related to a public comment that was submitted online. And it speaks to the conversation that we've been having over the past few months now about sick calls and the wait time. Just looking at the report, it's saying for sick calls, the longest wait time was 2 days. Yet on this submitted comment, it's saying that they submitted a sick call, or, they're speaking on behalf of an incarcerated person, saying that a sick call was submitted over 3 weeks ago. And I know you can say, maybe that was just a one-off thing, but we have gotten numerous reports. Like I said, we've been talking about it for months. People who are saying they're submitting sick calls and are not being addressed in a timely fashion. Can you speak to why there seems to be a disconnect?
Well, the report today, the reports that I submit to you guys is just a snapshot of that day. So like the numbers you have today, that is a snapshot of today. That's why it's only a 2-day wait. The public comments, I can look into those ones to see exactly what happened with that person. And again, if you're finding ones that are waiting weeks and weeks and weeks, just send me the name and I can look and see what's going on.
Okay. So what's the average wait time, you think?
So like I said, goal is always within 24 hours. That doesn't always happen. The goal is within 24 hours, you're seen face-to-face by a healthcare professional to see exactly what you need and what you're requesting. And at that point, you'll get rescheduled into another queue to be seen, either by a physical health provider, a mental health provider, mental health specialist, therapy queue. I mean, there's multiple queues that you can be placed into at that point to be seen.
I got you. And I understand that that's the goal, but, we've heard quite a few instances where that doesn't seem to be what's happening in practice. So you're saying if we come across that, just send it your way and you'll make sure that it's addressed.
Text me, email me, Teams me, whichever way you like. Just shoot me a message.
Okay, I got you. Somebody did, I guess, bring up the question whether or not that somebody receiving scheduled medication counts as a sick call, being answered.
What was the question?
For example, if somebody puts in a sick call and they receive medication, does that count as their sick call being answered?
If they address the sick call during a medication pass, that can't happen.
Okay.
So if they talk specifically about their sick call while they're getting medication, yes, that would be addressing their sick call.
Okay. Do you have any, idea or any, do you have any idea whether or not that happens regularly?
It can happen. I mean, I used to do when I passed meds, if somebody said, hey, I put a sick call in, I would easily pull up their chart, look at it, and address their sick call.
Okay. But is there any evidence or data that shows that that does happen regularly?
Some nurses do it that way. Some nurses go after their med pass on daylight. They can go before med pass on evening shift. There's multiple ways to address a sick call.
Okay, I got you. All right, so for this person who submitted a comment online, you're saying if we just get the name of the person, you'll be able to address it? Okay, that's it for now.
Yes.
Thank you. Here we go.
Thank you. And thank you, Rob, for setting the precedent with so many questions that I feel free to ask all of mine.
He was under 10 minutes.
No, actually, I really do appreciate it. Okay, I'm going to try to keep this organized in some way, shape, or form. Okay, I'm wondering, going off of Manny's last question about sick calls, if there's some way that we could get a breakdown of, I know we do waiting and completed, but I would like to see a breakdown of we consider this completed, but we didn't take any further action versus we actually took some sort of action that involves some sort of treatment in addressing that sick call. That would be really helpful, I think, so that we understand if the stories we're hearing are anecdotal or if it's more prevalent. 690 people waiting to see a psychiatrist with a longest wait time of 46 days seems so absurd to me. I don't remember ever seeing those numbers that high. Can you maybe help me understand why?
Sure. So we did have a turnover in our psychiatry staff, and that's not just a psychiatrist. That would include our APPs, our nurse practitioners, our physician's assistants that work within our mental health department. We did have a turnover recently of our staff. We've been lucky to get those rebuilt back up, and people are onboarded now, so you should be seeing a better number.
Okay, so
ongoing.
What are we doing in the meantime while we're waiting on that onboarding?
Well, like I said,
feel
we've already onboarded people, so action is already happening.
Okay, I just feel like psychiatry is not something that we should wait for, so I'm just wondering, was there any sort of harm reduction, intermediary actions that were taken?
Yeah, sure. So people can still see the mental health specialist. If there was anything acute happening, they can reach out and we can have somebody go down to see them. Our nursing staff also see people in groups and other things like that. So if something is an emergent or if somebody's under an acute concern, we can bring that up for in a more emergent need.
Okay, and what if it was an emergent need that required psychiatry to be tapped
Well,
in?
that's what I mean. So like there is a psychiatrist there that covers the acute pods. We have more than one psychiatrist now that are onboarded, so we can always reach out to one of the providers if there was an emergency.
Okay. All right, and then something that was talked about earlier, Ace asked the question about the HIV testing, and I know you said folks, it's like a voluntary opt-in. I'm wondering, is the STD testing also something you can opt out from?
So we offer it to every single person who comes in through intake.
Right.
If they don't want to take it, they don't have to take the testing.
Is that true also for the TB testing?
No, TB testing is required.
Okay, so TB testing is required, but STD and HIV are something that you just offer?
Yes.
Okay, why the difference between those?
With TB testing, we want to make sure that, we're not contagious, we're not going to be spreading any sort of communicable diseases. STD testing, it is, if they want to take it, they can take it.
Right, but are STDs and HIV not communicable diseases?
They are, but I would hope we're not spreading STDs, within a facility. TB can be spread within a facility.
Yeah, I'm just trying to understand the difference between why we're treating certain communicable diseases one way and other ones a different way.
I think I just explained it. If they don't want testing for STDs, then we don't force anybody to do that.
They can just spread it around indiscriminately, and we wouldn't know.
They shouldn't
I
be
know how
exchanging
STDs are spread.
bodily fluids with somebody else.
Well, it happens regularly inside the jail, so anybody that thinks it
Well, but
doesn't
that would
has
be the
never been in
logic.
jail.
That would be the logic.
Yeah, okay. All right, anyways, I'm not really still following that, but I shall move on. Okay, next question is about, I know we were starting to get into it, I didn't want to trample on Rob's question, but you said there's the two different types of commitments to tourists in Norristown, civil, and is the other one criminal? What is the other option?
The forensics.
Forensic, which means criminal charges.
Yes.
Okay, gotcha. So can you explain what those differences are to me? Because I thought it meant what kind of you were getting where, the forensic meant you had charges, civil meant you didn't, but you said that is not what that means.
What I would like to do for next month is let's gather up all your questions specifically for this, and we can get with the court administration, and we can explain all this before the next meeting.
Okay, in the next meeting, can we get a presentation in the next meeting, please?
I can't promise if court administration will show up, but I can reach out to court administration.
I know somebody on this board who maybe can influence that. Is that something you'd be interested in? Because I'd love to learn about that. Okay, thank you very, very much.
I don't want to step on you, Bethany.
Yeah.
Just, is this potentially a situation where an individual's not competent, not restorable, so there's no sense in sending them for a forensic evaluation, but the charges are still pending, and there's concerns about release, so you're waiting for a civil commitment on that side?
Yes, that can also be that, yes.
So they are not restorable, which means they are going to end up in a Torrance or Norristown anyways?
On the civil side.
Right.
Right, so they would end up in the civil side, but there's no sense in sending them for a forensic competency restoration because
They're not restorable.
Psychiatric evaluation that says that they aren't restorable.
See, that was a great answer. Thank you, Judge. I appreciate that a lot. And so I guess my question is, isn't the jail kind of one of the worst places you can be in a situation like that? So why are we letting, I know it's not you
we
that
can't
is
let 'em
letting
out.
them stay for 7 months. I mean, why are we kind of accepting the fact that somebody has been sitting in the jail for 7 months when they should be getting treatment somewhere?
But they're,
I think that is a question for the courts, right? I mean, so, and there can be various situations. I think 7 months is a very long time.
Yeah. I don't remember ever seeing something that high in a really long time, at least. So maybe, Judge, if you could notate that for our, I'm not trying to put a bunch of things on.
okay.
I'm sorry,
It's
Judge,
okay.
thank you. Okay. Next question is about, I know a lot of folks up here have touched on the wearables already. I guess my question is specifically that, one, what are the actual qualifications that, is there a list of diagnoses that would determine someone who would be given the wearable? What's Overwatch? Which, God, what a bad name. Anyways. Overwatch just sounds like dystopian, flock camera type stuff, But what are the actual specific qualifications that would preempt you to offer?
Sure. So we are focusing on anybody going through withdrawal management,
Okay.
for sure. And then anybody who's deemed medically vulnerable for our criteria that we've already had. So if you have a severe cardiac disease, if you're even severe seizures, you can possibly get put on one. At that point, it's up to the clinical decision makings of the providers and the nursing staff.
That's the providers in intake who are making those calls. And that, well, I know we're going to expand it to the jail, but after that happens to all the current population, will it then go back to just intake?
So no, we're going to expand it to letting the intake population continue wearing it up on the Newport pods.
Oh, right
It's
now
not
they
gonna go
don't
to the-
continue.
Correct.
Okay, so when they leave intake, bracelet comes off.
Correct. I mean, they still get their assessments when they get upstairs, and nursing staff still
Right.
sees them multiple times a day to continue those assessments. But we are hoping to roll that out very soon.
Okay.
Up onto the Newport pods.
All right, and I know that this is like a new program and we're still working out some of the kinks, but I have definitely gotten some reports already about like false alarms and them going off and disrupting people with sleeping in the middle of the night, taking staff time to address the false alarms. Is that something that you're seeing prevalent?
Do you want to share those reports with me? It
No.
could be after.
I do not,
Okay.
sorry. I was just
Okay.
thinking if you would know who told, yeah, no, I'm sorry, I cannot
Okay.
share them, but I guess I'm just asking, are you aware of any false
I have not
alarms?
been specifically told of anything like
Of
that.
a single one?
Oh, I mean, false positive, yeah. We had a guy alert earlier because he was playing with his bracelet.
Right, that's the stuff I'm talking
connection got
about.
lost. So yeah, it happens. It's going to happen.
Okay, and is there some plan, is that something you're watching, tracking, something you can address to make sure they're eliminated? Like, is it a technical glitch? Is it a,
No, the guy today was literally playing with his bracelet like this. He was just playing.
right, and so is medical responding then when something like that happens?
Yes.
Okay, and we'll continue to like make sure they're not going off for no reason? Like in the middle of the night, why would that be happening when someone's sleeping?
Well, I don't know. I need to know the person.
Okay. I can't do that, but I wish I could, but I can't.
Okay.
But okay, you're watching to make sure that doesn't happen?
Yes.
Okay, awesome, good enough for me, thank you.
And like I said, as we continue to roll this out and expand, we look at reports, we look at everything, we look at trends to see if things need adjusted. It's all going to be a learning curve.
Continuously.
For a little bit of time.
Good for me, thank you very much. Next question is about, can't read my handwriting. Okay, next question is about food specifically. So we had gotten reports about kosher meals. Like I even got to see an example of a kosher meal, and it comes in like this pouch and it's cold, and there's like 2 to 3 of them, and that is all that is offered for kosher meals. There's not much variety, they're not warm, and it also doesn't say what in the world is in the little pouch. And so I'm wondering, is that a new thing? Because that's not something I had ever been familiar with before, and wondering why that's how the kosher meals are served.
So we'd have to check with our food service provider, but that has been how the kosher meals have been served. And that's to ensure that there's no cross-contamination, that they are indeed kosher. But I can double check with our food service provider on that.
Yeah, and if we can even get, because they're getting it, from my understanding, these pouches every meal each day except for breakfast. So if there's only 2 to 3 kinds and that's 14 meals a week, that sounds like getting a little old pretty fast. So just if we can maybe expand those options, or if it could come with something that says this is what you're eating, I think that would even be a huge help, because right now they have no idea what's in the pouch. Thank you. Next question is about, the water. Okay, I have gotten so many calls about this. I know it's been pretty well explained both here and in the news. None of the incarcerated individuals, pods, or anywhere they access has been affected. It was 2 staff bathrooms that were closed off when it was discovered, right?
Correct.
Just want to put that into the record, because I have gotten numerous calls from people worried about that, understandably so. So who ordered the water to be tested?
That was a decision made by jail administration. So facilities does annual testing of the cold water towers at the jail. Those have always been negative. We are due again. That gets tested every August, so that will be happening in the next month. But we did some other air quality and water testing just as a preventative measure, and that was how we discovered.
Okay, so how often do you do the type of testing that happened where this was discovered?
We have, to my knowledge, not done that type of testing, like of specific faucets throughout the facility.
Right.
However, we are going to be implementing a water management program that will consist of regular testing of faucets throughout the facility.
Was there something that triggered the decision to do this type of testing for the first time ever?
No, just as a preventative.
Just as a preventive, okay. And how often do you plan to do this testing in the future?
So that will be at the guidance of, the health department, and we have a vendor that we've engaged to help provide us guidance on this. They're experts in this. So we will defer to what their guidance is on that.
Okay, and when this testing was ordered, was there a plan in place, like what we're gonna do if we find something, or was it just like, we're gonna test? Because it sounds like it's gonna be a lot of money to fix this problem. So I'm just wondering why the random sporadic test with no plan to fix it?
I don't know that we expected to find anything.
Sure,
We
right.
just thought, it's going to be preventative, and it'll give us peace of mind. We did get information to the contrary, so, we are doing what we can to respond and work with professionals to make sure that, the water is safe for the residents and the staff.
Great. And in the future, if testing happens, could there be some kind of plan to get like bottled water things?
We follow the guidance from the health department on that. So
And they say no bottled water?
They would provide that guidance, we would do it. No one in the facility has any illness related to Legionella, so that recommendation has not been made at this stage.
Okay, cool. And I'm getting the warning flag from the president judge, so I'm going to try to be a little quicker here with my last couple. Hope Pod, there was a really awesome article I read in Public Source. Yeah, in Public Source about the Hope Pod, which love the program. Just something stood out in that article, and I don't even know who to address this. Casey, maybe? I don't even know who to address this question to. You? Okay. They said that because they were talking a lot about recidivism rates, and they said that the Hope Pod does not track recidivism rates for program participants, and that to me seemed absurd, because isn't that kind of one of the main points of the Hope program is let's lower recidivism rates? So why are those rates not being tracked for program participants?
I don't have an answer to why they're not doing that, but that's something that we can talk to them about doing.
Please, because it seems that they're like following them throughout life post-release, so maybe just keeping statistics like that so we could show the need to expand it or fund it more or whatever that takes. I would really appreciate that. And then, out-of-county holds. So on this jail population summary that we get, I heard you say there's one person from Washington County, but on here it says there's 328 people with external holds. Is that because there's 327 people that have dole holds?
Correct.
And only one single person that only has an out-of-county hold?
So just to clarify my statement, yes, you're correct.
Okay.
Those are people that have dole holds, so they are still being held here in Allegheny County, as well as have an out-of-county hold on them. My statement that we have one person in the jail today is we have one person that is beyond 72 hours.
Okay, so we have other people who maybe are on 24 or 48 hours,
Right.
only one person.
We may have others that are, within that 72-hour time frame, but only one that is beyond.
Okay, and then can I just make a suggestion that when we do finally start charging other counties, or, my personal suggestion would be release them if you really wanted them, come and get them. But if the decision is going to be to start charging them, can we please charge an exorbitant amount that makes it, because it's really expensive to incarcerate somebody for even one single day today. So let's not be charging $75 to $100 to $200. Thousands.
$167.63 per person per day.
Is what it's costing us right now. Okay, which again is an increase since we expanded the MOUD. Yeah, I'm saying it should be like $1,000 a day if you want us to hold them.
We can't charge more than what it costs us. We will charge that daily per diem, as well as medical expenses if someone ends up in the hospital and things like that.
Why can't we charge them more than they charge us? We're doing a service for them. We can charge whatever we want to.
We're trying to be good partners.
I would not be when we have such a staffing crisis at our jail currently. So, but just my 2 cents. And then last thing also, while we're getting that report on out-of-county holds, how much money we have charged, which it's nothing yet, right? I would also like that report of how much money we have collected for tablets being out for too long. Thank you.
Thank you. Before we move on to public comment, the warden contacted me. She will be on a long scheduled trip for our next meeting, September 3rd. Requested that maybe we could reschedule it for August 31 or September 1.
It has to be in September because we're required by statute to meet once a calendar month. So unfortunately, it has to be in September.
Is everybody good with September 1?
September 1 is Tuesday. I didn't know we either have county council. Hold 1 second, please, Judge.
Okay.
I don't think you do, because it's typically on my calendar, and it's not on my
And
calendar.
it's not, yeah, and we meet the last 2 Tuesdays in August because we were on recess, so I think we're good on that Tuesday. What is it,
September 1.
Yeah.
Okay, so everybody, our September meeting will be on September 1, and we will post that. Okay, back to public comment. Sarah Hampton.
Anybody from the public object?
Okay. Hi. Okay. Hello, my name is Sarah Hampton, and I'm a criminal defense attorney speaking again to emphasize my concerns about the absence of attorney notification from the proposed hospitalization policy. I strongly urge this board to add language to the policy that requires notification from the ACJ directly to attorneys after an individual has been hospitalized. 2, requires notification from the ACJ directly to their attorney as to why or how severe the hospitalization is. And 3, requires that individuals be provided with the means to contact their attorney while hospitalized. This information does not pose a security risk, but is instead the bare minimum information needed for attorneys to communicate with judges, prosecutors, and victims alike about how hospitalization will impact the timeline of a case. Excluding attorneys from that process, while also preventing clients from contacting their attorneys, raises serious constitutional concerns. When attorneys are excluded, real people suffer serious consequences. Some real examples. My client was hospitalized for unexpected surgery less than 24 hours before court. In the courtroom, he seems disoriented and confused. I think it's exhaustion from stress. Imagine my horror when instead I learned that he's heavily medicated and in extreme pain from being sedated. Imagine his horror when he finds out that despite ACJ personnel repeatedly reassuring him that his attorney would already know and would already request a postponement, that I had no idea and he had been lied to. My client is hospitalized. He is not allowed to call me. He writes me pages of letters he is not allowed to send me about his case. And when he's transported back to the ACJ, all of his unsent letters are confiscated and destroyed. My client is hospitalized. I call the ACJ repeatedly for a month. I'm not allowed to know how long he is expected to be hospitalized. When the judge asks me for a timeline in his case, I can't give her an answer. My client is hospitalized. Like many, she has no emergency contact. I am her sole advocate. Because she's not from here, she can't remember a phone number, she was homeless or living in a domestic violence shelter, or a million other extremely common and predictable reasons that we know happen in the jail. My client is hospitalized. He is dying and his judge wants a plan about his release, but I can't talk to him or his medical team per ACJ policy. The ACJ is told the judge wants a plan, and suddenly I am allowed to know that the ACJ has made a plan with the hospital. The judge releases the client solely based on my revelation of that plan. Less than 12 hours later, I am at the hospital, where I'm denied 3 separate times from seeing my client because he was formerly incarcerated. The hospital cites the ACJ policy. His medical staff says there is no plan. And also, now that the ACJ is not paying for him, he has to go. I remind them that he's dying of cancer and can't walk. That's why he was released from jail. And they say that they can't walk him through everything. He just needs to pick a shelter, or he can wait on the street to die, which he did. The stakes are too high for attorneys to play catch up with vital information whenever someone is hospitalized. Please revise the policy. Thank you.
Thank you. Karen Burns.
Good afternoon. My name is Karen Burns, and I am a proud member of the Pennsylvania Interfaith Impact Network's Allegheny County Jail Action Group. In keeping with PIN's practice of maintaining a monthly reminder for all of us, the JOB, the ACJ administration, the court, and the Allegheny County public, of the 31 ACJ incarcerants who have died since April 2020, please stand and join in respectful silence for this reading of their names. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastorick, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolata, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonamo, Zachary Somm, Nicole Barufi, Richard Shuba, Terrence Clowney, Tracy Hickey, Justin McAuliffe, Nathan Piernick, Mark Schwartz, and Tyrone Good. Thank you.
Brian Engler.
My name is Brian Engler. I'm president of the Correction Officers Union. I just want to say we look forward to working with Warden Clark on all these issues, and I also want to thank her, as well as Judge Ivashevich, John Kenstowitz, Dan from Healing the Hero, and Dr. Fong for stressing the importance of this for correction officers. The actual cost is $1,995 to train each individual for peer support remotely. That's absolutely a doable expense. I wanted to address some issues that were troubling the officers. That was mentioned about FMLA. From January to July, we have worked 123,303 hours of overtime. Worked. That's not including jobs that were cut. A lot of officers were upset about the FMLA comments Ms. Howell made, so they wanted me to apologize on behalf of them. So, for example, Officer G said he's sorry he couldn't work more of those hours. He just didn't have it in him to tell his wife to tough it up and take his 4-year-old to leukemia so he could go work at a jail that's been understaffed for 10 years. So he apologizes. Officer D really apologizes because 5 years ago he was given 18 months to live. So he's sorry he's not working as much overtime as he used to. He beat cancer once, twice, and now he's on his 3rd round of head and neck cancer. He would love to work more hours, but again, the 123,000 hours is due to understaffing, not family medical leave. Officer H would like to apologize because even though he stays 3 days a week, he was in my class. Sometimes it's difficult with his colostomy bag because of his colorectal cancer. Officer D would like to say she's sorry. She doesn't come in on her days off anymore because she's pregnant and she's working a double every day so that she has enough time to take off family medical leave to be a mom to their first child. Officer D also apologizes. You know, his mom didn't want to take an Uber to Hillman for her breast cancer, but you don't have to worry about his FMLA anymore. She passed away. So all these officers say they're going to do a better job to try to work these crazy hours so that we can't be accused of FMLA abuse. And I'm just going to give you an I'm sorry card about it. Thank you. We're very sorry.
Thank you. Jill Koffanova. Sorry.
My name is Jill Kokenauer. I'm a CO at the ACJ. I'm not a seasoned long-term employee, but I'm not new either. I work pods mostly. I just wanted to touch on, there were a few things I could touch on, but I'll keep it short. Officer safety, we have levels that the doors don't open. We have to call to have control open them over the radio. I don't know. My door on 5 Echo on my pod has been, the button still doesn't work. I put in a maintenance request every single day for months. Also, I think too, as far as codes go, I don't know why we can't take the steps. We're like waiting on elevators. I don't know why that, I mean, not all of us would, but I would. The tablet situation puts us at risk. Before, we would collect them at night at a certain designated time, and then I personally inspect them, just make sure, no cracks, nothing like that. Now they go get them, they put them in there. There's a lot of, they can break them and we wouldn't know. So, I try to, go over them, but it's not in my place. They're right on the pod. Also, I think too, like when you work a pod and you're there every day, you kind of get a feel for like the flow of things. We're not able to lock people in, not necessarily as punishment, but maybe more like a timeout. Sometimes you can feel when things are off on your pod, and maybe just like, all right, let's lock in until trays come, and just to kind of reset almost. We can't have like individuals that are, fighting. We can't separate them. We can't really do much as far as that. So sometimes I just feel like a concierge, which I'm happy to help, but we're supposed to be helping them like learn rules and discipline, and that we really can't do that. The unit managers, I get why they did them, but now they have a whole level. I used to be able to get like greens, underwear. I could get things for the inmates that would come to me and ask. Now we have to do this step by step by step. And for example, today, this guy's like, I've asked for 3 weeks for an armband. He gets, he's part of the mod program, needs an armband to get it. And so, going through. So, we don't have, officers don't have the power that we used to, which I kind of get to a certain extent, but like, I can't help people, and now I'm waiting on, it's like pass the buck. So I feel like, the things that I want to help, I can't do without, all right, email the unit manager. First it goes to the supervisor, then it goes to the unit manager. It's like extra steps maybe that don't need to happen. What else? That's all. You're welcome.
Thank you. Joe Shaughnessy.
Hey, good evening. Joe Shaughnessy with PIN. As was reported by Warden Clark, recent testing at the jail has been revealed possibility of Legionella in 2 faucets in the jail. Here are some things to consider. For those who are unaware, 99% of people who get it are hospitalized and 4% die. So this situation must be taken very seriously. I'm sure it is. Bottled water should have been provided to residents, as they have no other alternative but to drink from the faucets inside their cells that is very close to the cell toilet as well. My understanding is that all staff have the ability to buy bottled water. Clean water should be provided to ACJ residents until the health department clears the entire jail as safe from Legionella. Medical care takes longer to get in the jail. The time it takes to file a sick request and then be seen slows the time it takes to get treatment. Thank you, board, and all involved in moving the policy, moving the responsible family and attorney notification policy. It is even more important to take this disease very seriously, as residents and their families are going to be very worried until all clear is given by the health department. PIM would like to remind the Jail Oversight Board that responsible family and attorney notification is still an issue we are hoping to fully see implemented in the very near future. Thank you.
Thank you. Jill Ratliff.
Good afternoon, everyone. My name is Jill Ratliff. I'm an organizer with Active Pittsburgh, here to comment on the availability of HIV testing within the Allegheny County Jail. Knowing your HIV status is the first step to lowering transmission and accessing treatment. Yet at the ACJ, testing is generally only offered at the beginning of their stay. Think about what that experience feels like. People have just been arrested. They may be frightened, worried about their families, or simply trying to wrap their heads around what is happening to them. This is one of the least likely moments for someone to meaningfully consider an HIV test or to make informed decisions about their health care. One opportunity is not enough. We recognize that residents can request HIV testing at any time, but the reality is that stigma surrounding HIV, combined with the loss of agency that comes with incarceration, makes self-advocacy far less likely. It is the responsibility of the jail to publicly offer and incentivize regular HIV testing in ways that can reduce barriers to care, rather than placing the burden on incarcerated people to ask. We are calling on this board to require that HIV testing be offered every week to residents of the jail on a voluntary basis. Regular opportunities to test recognize that people change their minds, recognize that trust is built with medical staff over time, and that people deserve more than a single chance to learn their status. Allegheny County is home to community organizations with years of experience providing HIV testing, education, and linkage to care. These partnerships already exist and should be brought within the jail to expand access and ensure people receive compassionate, culturally competent services. We demand that residents be compensated for participating in HIV testing in the same way they are currently compensated for receiving COVID and flu vaccines. If the jail recognizes that incentives increase participation in other public health interventions, then the same principles should be applied to HIV testing. There is no public health justification for treating HIV differently. People in jail remain members of our community. They deserve the same opportunity to know their status and protect their health. Expanding HIV testing is not just good medicine, it's good public health policy. It reduces transmission and it saves lives. We urge the board to act now by implementing regular voluntary HIV testing, partnering with community providers, and ensuring residents are fairly compensated for participating. Thank you for your time.
Thank you. B. Claymeyer.
Hi, I'm B. I'm an organizer with ACT UP Pittsburgh. ACT UP is the AIDS Coalition to Unleash Power, and we are committed to direct action to end the AIDS crisis and protect the health and safety of all trans, queer, and HIV-positive people in Allegheny County. ACT UP met with the medical staff at ACJ a few months ago, and we were informed that incarcerated people at ACJ are only offered HIV testing once. Outside of that initial medical intake, incarcerated people have to request an HIV test. This is not enough to ensure everyone at ACJ knows their status, receives treatment, and prevents the spread of HIV, which is a public health necessity. And it seems today it's been made clear that people on the staff at ACJ need a little more education about how HIV and STDs can be spread in the jail. And I know a lot of community partners who would be so happy to do that education for you all. So if you're willing to work with us, we can teach you all about HIV and how it can spread even in the jail. It is clinically recommended that you are tested every 4 to 6 weeks. We believe having community partners come to the jail to offer testing every week will allow everyone the opportunity to be tested regularly as clinicians are saying they should be. We also believe that they should get paid for testing just like they're paid for vaccines. HIV and STDs are serious public health crises, and it's really concerning that you're laughing them off as something funny that can happen and that couldn't possibly happen in the jail. And that was really disrespectful. So I think you should do better, and thank you all.
Elizabeth Schonger.
Hello, I'm Elizabeth Schonger, S-C-H-O-N-G-A-R. I'm a member of PIN, and I'm winging it because I've learned more about what's going on with the notification policy, and I must admit, there are several things that really please me. First, that there is a policy. It's much easier to critique something that you can actually see what the policy is than to, and work on it. Than when you don't know what the policy is. Second of all, I'm very pleased that you're including the issues around people being authorized to have information released, as well as just whether they will be contacted. Because so many people assume that if they were the emergency contact for a medical emergency, which is what it said in the old stuff still on the website, that they would therefore know things like what doctor is coordinating the care. And that's even if they weren't allowed to know what institution the person was in, but they could at least contact the doctor. They could at least tell the doctor about situations related to the person's health. So I'm very glad that that's being included. Now, one of the things I'm concerned about is I'm not sure what you're going to consider a medical emergency. You did say that admission to a hospital is a medical emergency. I'm glad with that. I think it also needs to be anytime someone goes to the emergency room, because it's not just a matter of whether they're going to stay overnight. It's whether there was something that was serious enough that it wasn't something where you made an appointment and had them see a specialist when the time came. I'm really glad that people are bringing up the subject of contacting a lawyer. Partly because, of course, the whole administration of law depends on them knowing something. Not necessarily a lot, but at least a timeline. But also because whatever is going on with a person's health often indicates whether their treatment in the jail has been what we would want it to be. Lawyers need to have an idea. So I really strongly support that. Talking to someone on the ride over, because we were brainstorming, we're concerned whenever anyone in the jail loses the ability to contact their family or lawyer due to medical reasons, including mental health reasons. Even if it's as simple as having a pad, or whatever you call those things, withdrawn from them so they can no longer make that contact. Their family is left hanging. They have been in touch with the person, now they can't seem to get a hold of them. Their lawyer is left hanging. So anytime there's a medical reason that they can't contact someone, whether it's because they've moved to a pod where they can't contact people, whether they've just had,
Thank you. Sharon Bonavoglia.
I'm here representing PIN, and we would just love to welcome Connie Clark as the new interim warden. We are rooting for you. We are so glad to hear you talking about all of the innovations and initiatives that Trevor Wingard started that you intend to be moving forward. And with that, the evidence is the policy, the family policy that you brought us tonight. And I will just say that representing PIN, we are very grateful that that notification is in place, even when it meant that you did that without the full support of the entire board. And I would like to point out and thank Rob Perkins, Bethany Hallam, and Manny for pressing to do that, even when the rest of you were not willing to vote on that, and that you all continued to act even without that kind of support. Having said that, I also want to thank you, Barbara Griffin, for bringing up some really important questions tonight about how to make sure that those emergency contacts happen. It means a lot to us at PIN when people on the board are looking out for our neighbors in the jail, and that is an excellent example of looking out for them. Thank you. I also would like to thank Judge Ivashevik. Aryeh, listen to me. I'm thanking you, Judge Ivashevik, because I give you a hard time, and I know I do. And I want to thank you for stating very clearly that if people are being held from treatment because other counties aren't stepping up, that you will put your position online here on this board and in the court to say, get them to treatment. Who cares what the other counties are doing? Thank you. That is, again, an example of looking out for our neighbors in the jail, and we greatly appreciate it. I do want to take the time, because I did at County Council and Executive Innamorato, I think it is very important for you and the entire County Council to be looking very seriously at all the reasons that Warden Wingard left, because I will say it again, I don't believe for a minute that all of a sudden he missed his kids in the Carolinas. They were there when he came and told all of us stakeholders in a meeting that he was going to be around for 5 years at least. So it very much concerns us at Penn that we don't know where, because we're not you guys and we don't have the authority you do to look into it. It just smells bad, and it smells like a lack of support, and that he went someplace where there might be better support. And in uplifting Warden Clark, we want to make sure everyone in the county is uplifting the work that she wants to do in reforming the jail for our neighbors there. Thank you.
Thank you. Jody Lincoln.
Hi, Jody Lincoln. The announcement of the Overwatch system has certainly spurred a lot of questions and important discussions around surveillance and privacy of individuals' healthcare data. These are really important questions to ask and should not be quickly dismissed. Foresight should continue to be questioned and pushed about their use of data. They may have a policy right now about not selling data and anonymizing it, but that can always change, and prison tech companies should not be trusted. I like to think that the jail is acting in good faith, though, piloting these devices in a genuine effort to improve health outcomes and save lives. We've been in this room numerous times discussing the deaths or serious medical incidences of people whose outcomes may have been different with an earlier intervention. It's frustrating, though, that the jail and this board have not been able to pass a comprehensive family or attorney notification policy up until this point. But it sounds like that's happening. Without having seen the policy, I hope that it addresses the numerous concerns people have brought before this board and is based in care, compassion, and considering the humanity of people and their families. Don't let the continued concerns about safety from the Sheriff's Office keep us from passing this essential policy. And please listen to the feedback you've gotten today, both from board members and from our attorneys, about including an attorney notification policy in here as well. But yeah, I just want everyone here to remember that, you do fundamentally care about the health and well-being of people at the jail, that you are concerned whether they live or die and receive their proper treatments and prescriptions. So let's continue pushing policies like this family notification, improving the health care, changing our practices on giving out prescriptions. We've made so many strides over the last few years under new leadership about the way medical care is given at the jail, and we can't stop now. If we can spend $400,000 on 100 watches, we can figure out a way to have a comprehensive medical notification policy, and we can continue to offer people better health care. Thank you.
Lizzie Jones.
Hi, I'm Lizzie Jones, here with Our Streets Collective. So I'm here to talk about an incident that I witnessed last month on July 3rd. Sorry, I'm a little nervous. This is my first time at one of these. Whew. On July 21st, I was outside of the jail with Our Streets Collective when I saw a man get shoved out of the jail doors. Tuesdays outside are usually pretty energetic, and I was a downtown resident for the last 5 years, so I've seen some stuff, but this felt really different. So this man was, this was really distressing, actually. This man that was shoved outside of the jail doors, he was half naked, he didn't have any shoes, and he was bandaged, visibly for all his legs, and he was crying out for help. Myself and another volunteer walked over to see what was going on. We attempted to help this man walk to a seating area, but he couldn't make it. It was too hard for him. So we brought over a folding chair and helped him sit. He was clearly distressed. He was crying. He was screaming, clearly in pain. As we worked with him to calm down, one of our medical volunteers came over to give him an assessment and recommended immediate medical assistance, and that we call an ambulance. Whew, sorry, guys. This is when I noticed that his partner or his advocate, I'm not really sure, showed up and asks, where's this man's paperwork? I didn't know about this paperwork. He didn't even have his shoes. So as the ambulance, we called for the ambulance, the police came instead to assess the situation. We asked these police to help us retrieve Lee's personal effects and required paperwork that he was looking for. And they obliged, and they went into the jail to go look for this and summon the ambulance for us. Well, the EMTs, a CO, finally came out with the paperwork for the officers. He took it. It took multiple asks from me and other volunteers to get this paperwork to this man before he was driven off in an ambulance. And I'm not sure that without this relentless advocacy that he would have gotten that paperwork in time. I don't know that man. I don't know this man. I don't know what happened to him after he left that ambulance that day. But I know that that was unnecessarily cruel. I know that just shouldn't have happened. And that seeing this happen to a stranger drove me here to my first oversight meeting here. So my questions are, where is this man's shoes? Where is his paperwork? Why was he released without the paperwork? Why did it take multiple requests from a stranger to get that paperwork together? Why was his partner ignored? Why didn't she get that paperwork handed to her? And in what world is the procedure for release this? Thank you.
Thank you. Jack Keller.
Good evening. My name is Jack Keller. I'm a 2L at Pitt Law and an intern at Abolitionist Law Center. I wanted to flag some ongoing concerns about the discharge and release process, which we've already heard a little bit about. We've been regularly hearing reports of individuals being released without bus fare, their commissary, or even their shoes. Others have been discharged after the discharge and release center has closed, leaving them with nothing. I do understand that an officer was suspended following an improper discharge, which I think is wonderful, and I hope that we see more accountability. I was going to go into Mr. Duncan's story, which was relayed the facts right before this. I think that sums it up better than I could have. I also know Mr. Duncan's spouse is here, and she'll be speaking today too, so I want to let her speak to that issue. I hope you hear her. I hope you hear how serious that issue is and pay closer attention to how we're discharging members of our community. And please codify the family lawyer notification. It seems like a no-brainer. Thank you very much.
Thank you. Leah Bloomfield? Sorry.
I'm concerned about five issues that relate to the Mr. Duncan the previous two people spoke about. 4 of them are negative, but 1's positive. My significant other was arrested July 8th. I was told by Kane that he was at the jail. When I called for 4 days, I was told he was in processing. Then I was told that he was on Pod 5. After that, I was told he was no longer at the jail. I asked if perhaps he had escaped, but I was told that was unlikely. So I had no idea where he was all this time. Then I learned that he was supposed to attend a hearing on July 20th. It was all the way in McKeesport. I made sure I got there. I didn't see him. I didn't hear anything about him. And finally, when I asked one of the PDs about him, I was told that county did not transport him because of his mobility issues. First of all, I wasn't aware that his mobility issues were that bad. Secondly, I was greatly relieved to know that he was somewhere, and that somewhere was still in custody. One kind person in discharge, I'm not sure if that's the correct name of the department, but she called to tell me after I had called many, many times to find out where my dude was, that he was being released within the hour. So I hurried downtown, breaking speed laws, I'm sure. When I arrived, I found a group of advocates outside the jail. I saw my honey, and I found out that he was forcibly ejected by 2 correctional officers. He was barefoot, he had short shorts on, and he had he had a T-shirt on. There was half on him. At least I knew that he was still alive. That was my first my first indication from July 8th. Those two officers that had evicted him by pushing him barefoot out onto the hard concrete, I found out from the people who had witnessed it that only one of them was suspended. And I said, only one? And they said, well, at least there's one. Okay, 1 out of 2. I noticed right away that he didn't have any paperwork on him, and I was most concerned about this because he's on meds. He's on a maintenance dose. He's on high blood pressure meds. He was there with no paperwork at all. And I announced very loudly that he needs his paperwork. I knew by this time he was going to the hospital, but with no paperwork, how would they know what to give him? So after loudly voicing my concern and after being helped by the advocates, finally his paperwork arrived, very impolitely, and it was given to an EMT. One last thing was, I discovered at Mercy Hospital he was dosed Monday morning. He was released forcibly from the jail Tuesday at 6 p.m. He had no dose at all that day. And I heard, it's not secondhand, I was at Mercy when I heard the person through the phone from the jail say, our last dosing was Monday morning. This was Friday, and apparently the EMT didn't even give the paperwork, which I had peeped myself him getting. Didn't even, and I know EMTs aren't your responsibility, and I appreciate that. But I just want you to know, had I not spoken up, had people not spoken up, he wouldn't have had any paperwork whatsoever.
Okay, thank you.
Okay, thank you.
Thank you so much. Frank Fikowski. I'd ask everybody to please, when you hear the buzzer go off, your time is up, so please don't continue to talk.
Okay, I'm here today to talk about Overwatch, the biometric system that they're implementing in the jail. And first I wanted to discuss that while these technological advancements are always, well, can be a positive, we must remind ourselves that these are human beings and the ACJ has a duty of care. Medical staff can't allow this to become a crutch or to be something that lets them not have to check on people because, hey, we have this wristband. It was said that this is going to be done for people that are suffering from withdrawal, perhaps, or previous cardiac issues. The Oversight website itself says for anxiety and high blood pressure. So these are wildly different things. I have anxiety, I had high blood pressure driving over here. So again, we can provide comprehensive medical care. This Overwatch product says that they provide holistic medical care. Holistic medical care is talking to human beings and asking them if they're okay. $327,000 over 2 years in the opposite could easily hire 2 to 3 medical staff more to talk to people if we're concerned about health. Secondly, and perhaps most importantly, who will have access to this info? It's gone over like, I don't need to cite data breaches from these various companies or your data being sold. We get the weekly emails. We all get weekly texts that our data has been sold. But I believe Holly Martin said, well, there's medical staff and correctional officers have a tiered system of access, but if the company only provides vital medical information, that's it, what's the tier? So correctional officers will be having access to this live. This is something I think the Oversight Board needs to find out. What is the live access like to this, and how will correctional officers respond? We know how police officers, their cousins in the blue, perhaps react to mental health crises with people in the public, and that they may not be the best tip of the spear. Now, Overwatch says, well, the jail says in the article that this is merely for vital management and looking. I looked at the Overwatch website, the Foresight Labs website. Conveniently right at the press release of the Allegheny County Jail integrates Overwatch is a stock photo on the $6.7 million company's website, so I would imagine that they invested in what photos, of a fist fight. And I can give this to you guys, perhaps to go with the sorry card. A fist fight right here, one of the 3 main photos. So are these going to be COs responding to Crises such as the thought crimes of anxiety or high blood pressure in the most stressful situation in their lives. Are we putting correctional officers with this live health information to intervene in violent matters? Thank you.
Corey Roma.
Please, thank you so much.
It's here in my
I appreciate it. No envelope? Thank you.
Yeah, sorry.
Hello, Corey Rama. I'm here to play a recording from a recently incarcerated individual who was released after discharge after the release center closed and his experiences with that, if you will bear with me for 1 second.
Here from my name is Benjamin Newell. I got extradited here from Los Angeles 3 months ago for like a 10-year-old case, which they dismissed, which I'm thankful for. But when they released me from the jail, they didn't give me an opportunity to even use the phone to let anybody know that I was leaving. I got no phone, no money. I got $500 on my books that my mom put there specifically for when I got out, so I had something when I got out, and I got no access to that. I'm not even going to be here tomorrow to get the check, so I don't even know if they can mail it. So I don't know what I'm going to do. I don't know nobody here. I'm not from here. I would definitely do something about the process in which people were released. I heard that we were going to get a phone call downstairs when we were changing out when we left, which there was no phone call. They rushed me out of the pod when I tried to make a phone call, and the guard rushed me out to go sit in the hallway and wait, to sit downstairs in the tank and wait, to not be able to call nobody. So now I'm stuck outside stranded. I'm not sure what I'm going to do. So I would definitely say that some type of procedure policy needs to be put in place to make sure that when people are released, they're not left out on a bad city block with nowhere to go. But on a positive note, I would like to say that as far as jails go, the staff was completely courteous. The COs were nice. Like, compared to where I've been on the other side of the country, the manner in which the staff deals with the inmates is by far better here than any place that I've ever been. By far. The food was better. Time out of our cells was better. Like, the life as an inmate here, I gotta say, was by far better. You can even get hardcover books here. So, I don't have all negative things to say.
And that experience is not atypical of what we experience when we table outside of the jail on Wednesday nights, and also on Sundays when we're down in front of 2nd Avenue Commons. In my personal experience, the thing that is needed most, when people are leaving, is a phone call, a little bit of money to get home, or quite frankly, placement, because a lot of them don't have a home to go home to, and they're just expected to stand around in the streets like that's where they live, and then the police come because they're vagrants or whatever, and you just repeat the process of reincarcerating and completing this whole process all over again. So really would like you to take special note, especially you, Warden Clark, of when these people are being released and if it coincides with them being able to get resources from the discharge center. So thank you all.
Thank you. Tanisha Long.
Don't start yet. I just walked over. I didn't bring a card because I'm an adult, so sorry about that. I'll save it for next time. Maybe I'll borrow Connie's bouquet. But one, I would like to say, Connie, welcome. I think a lot of people here have a lot of high hopes for you, and it is good that you're starting off communicative. We appreciate that. You're starting with a policy. Second, Casey, welcome. I have always found you to be like a bright light in the jail, so I'm like, oh, more Casey, love that for us. And that's all great. I would also like to say that before we spend hundreds of thousands of dollars on health monitoring tech, we should be spending that money on the surveillance technology we actually need, which is body cams for corrections officers. That is something that would improve the lives of incarcerated people, not surveillance technology to let you know when they get overly excited. What I would also like to say is that I've been to discharge and release before. I've done the jail tours, and they're usually some of the most pleasant people I've dealt with in the jail. But something is happening where incarcerated people are not getting that experience, and there is some sort of disconnect where from discharge and release, or to not even seeing discharge and release, they're encountering corrections officers who don't believe they deserve their money, who don't believe they deserve shoes, who don't believe they deserve medication. One thing that's being missed from this conversation is he doesn't have his paperwork, but I also know the jail has a policy to release them with medication too, and he did not have that either. And people are missing that. I think people are also are forgetting that when incarcerated people are dumped on the street without resources, they die. We have the case of Daffy Mitchell, who died in Pittsburgh after being released from Washington County without the correct communication services, without the correct clothing, and without contact to her family. And had this individual not encountered the same people that the corrections officers really wish weren't in front of the jail, this person probably wouldn't have had a good of an outcome, especially given that they couldn't walk. And as someone whose mother was released from a jail without being able to walk and without having an assisted device, without having family members there, that person could probably die. I don't know what's going on with the discharge and release process, but it is shameful how it's operating right now, and it can't continue this way. I think that it's hard to step into a new position and walk into a lot of criticism, but like I tell the COs, this is the job, right? And none of them are serving sentences, just like we're not serving sentences. We're here by choice. And incarcerated people oftentimes aren't there by choice. And that can be argued as much as we want. But at the end of the day, we need to make sure that we are doing everything in our power to provide the care that they deserve. Thank you.
Holly Hickling.
Hi, I'm Holly Hickling. I'm the executive director of the Global Switchboard. We're a human rights organization here in Pittsburgh. I'm here also to speak on the health monitoring and tracking with Overwatch devices. I kind of second everything that the questions other people have already brought up. I do want to emphasize that as human rights advocates, we support efforts to protect ACJ residents' human rights in all areas, including health. We're happy to see health improvements being talked about. And we also affirm decarceration and having fewer people in the jail. I wanted to mention that because I think that would help some of the overtime concerns. A couple of things I wanted to lift up about the Overwatch programs. One red flag that other people have brought up is that this company, I don't know if people brought this up or not, this company is benefiting from incarcerated people's data. They are going to use that data to train AI, and whether it's anonymous or not, they're going to make money off of people's data, health data. And I really liked what the HIV advocates brought up, which that people need to be compensated, people need to be incentivized. So if people are profiting off of, our community members' data, how are our community members profiting besides just being monitored? I also wanted to highlight the price tag. If we can spend this much on a shiny, new, exciting way to help people's health, can we actually invest that amount of money in some of the problems that we already know about and the solutions we already know about, like what Manny brought up with health complaints being responded to in time when people actually know they're going through something without having a device need to tell you, but they can actually tell you themselves that they're going through something. I wanted to give a quote from the UN High Commission on Human Rights about data innovation and privacy. They say these technology developments carry very significant risks for human dignity, autonomy, and privacy, and the exercise of human rights in general, if applied without effective safeguards. So I just want us to make sure that we can see the contract with the company and that we're asking all the right questions and we're putting all the right safeguards, including ending that contract if we don't think that it's protecting people in the right way. Thank you.
Callum Burns. Callum.
Hi, I'm also here to speak about the new health monitoring devices. Like everyone's mentioned, I think we really do appreciate the the idea of, supporting like preventative health care, that sort of thing. I just have a few questions after going over the press release and a couple of news articles that I wanted to ask. And, I think we would all really appreciate if you would address publicly. One thing I wish with public comments is that, some of our questions like would be answered eventually. So first of all, how does Foresight Labs store that data? Does the jail store that data? The device, it's mentioned as being something that can help you track like health over time. So I'm wondering how that works. I know that the device is supposed to be HIPAA compliant. That's a big thing on, Overwatch's website. But I think it's always good to take initiative on the part of the jail as well to make sure that they really are HIPAA compliant. I think especially some of the language is kind of vague surrounding what they track. I know there's health conditions involving the heart, but there's also stress levels. People have kind of brought up some of the concerns there about what that might entail. I'm wondering, can the stress monitors be used against people if there was some sort of incident in the jail? Like, would that data be brought up? Also, with the AI, this device does use AI. Is it being trained on this data? I think that's a very important concern. And then one thing I wanted to bring up as well when it comes to opting in and opting out of a device like this, on the press release, it says that this device may be used to help people who are unable or unwilling to provide their medical information with staff. So I'm wondering what exactly that means if people are actually able to opt out of it. I appreciate educating people before they decide to forego this device, but there's also, they don't currently have to sign a release for their information, so I'm wondering how they're being educated on where their data is going and that sort of thing. And that's just kind of what I wanted to bring up, some questions to mull on. Thank you.
Thank you. Okay, before we adjourn, the executive would like to make a comment. What? I don't see your name anywhere.
Well, we never did.
Go ahead.
I just want to say about the wearables, I think there was a lot of people talking about the cost and talking about the why. And this has been an effort that my administration has taken on over the last 2 years. And the reason why is because every month we stand up and we hear a list of names of people who died in that facility. And people died most often in intake. And when we have the tools like a wearable, we can monitor people's vitals while they're detoxing, while they're waiting to be placed in a pod. And this has been an effort not only by the jail administration, but by people within the county manager's office, the executive's office, to fundraise that level of money so that we can get that level of technology, so we're not relying on people looking through a window to see whether someone is breathing or not. And I think that there are absolutely valid concerns when it comes to data sharing and protecting people's private information and making sure it's not going into the AI. But the intent of this is to save people's lives, and we should not be lost on that why, because that's the foundation of that investment. So I do hear the concerns. We will address those concerns, but we should all be celebrating that this administration took the time to raise the money to put these in place so that we do not have to stand up here and listen to another name of someone who should be with us, not be with us, because we did not invest in the right technology to keep them alive. So I just want to share that with everybody because I was getting a lot of questions on why this is happening. There's no deal here. We're paying money so that we can monitor people and we can make sure that their vitals are okay so that they can live a full and healthy life post-release. That is all.
Thank you. Okay, who's the man? You could come up. I personally checked the online registration and it was empty today, but accidents happen, so
Thank you.
please state your full name, okay?
I appreciate it. Thank you. My name is Nino Testa, and I'm an educator and a resident of Allegheny County. I appreciate being able to speak. I'm also a member of ACT UP PGH. ACT UP is a diverse, nonpartisan group of individuals united in anger and committed to direct action to end the AIDS crisis. I'm here today to ask that the Allegheny County Jail adopt ACT UP proposals to expand HIV testing in county jails. This includes weekly opportunities for HIV testing in conjunction with community partners who can staff this testing, and the pay of incarcerated people who choose to be tested, similar to the pay that incarcerated people earn for receiving vaccines. And since there has been some confusion about what public health experts have said about the role of county jails in preventing HIV acquisitions, according to a peer-reviewed 2023 study published in PLOS ONE, which is indexed by the National Institute of Health, quote, maximizing the yield of HIV testing and provision of test results in detention facilities could promote rapid entry into care for those who newly test positive, rapid re-engagement for those whose positive status is confirmed but have fallen out of care, and new engagement into PrEP for those who test HIV negative. Ending the HIV epidemic will need public health. This is their conclusion. Ending the HIV epidemic will need public health and correctional systems to collaboratively manage HIV in jails more purposefully, end quote. The role of the county jail in addressing HIV/AIDS has been established time and again by researchers from a variety of relevant fields. ACT UP PGH asks the Allegheny County Jail Oversight Board to follow this research and to take seriously its role in ensuring that every resident of Allegheny County has what they need to live a dignified and full life as valued members of our community by ensuring weekly access to HIV testing that can save their lives, help them to enter treatment, help them to return to treatment, and help to prevent future HIV acquisitions in our community. Thank you.
So moved.
Second.
Everybody in favor?
Aye.
Yeah.